Hello and welcome back to The Power of Your Health. I'm your host, Dr. Freeman, and on today's episode, we are going to talk about trauma and exercise. I'm super excited that we have our very special guest back again, and that is Dr. Reuben Rutland. If you did not listen to our previous episode on trauma and nutrition, you're in for a special treat. Please go back and listen to that. Today, we are going to continue the conversation on a very important topic that affects all of us, and that is exercise. I don't know about you, but exercise is so vital and critical to healing, and our body needs it. Your body is meant to exercise. It's meant to work. It's meant to move. It thrives, and your body, believe it or not, it does desire to move. We have to be proactive in getting into a gym, whether it's in your home, whether it's outdoors. Whatever you do, please make it work, because we want to let the food be our medicine. We want to heal our bodies and restore our bodies from a natural wellness standpoint. And, you cannot be well just on diet alone. You have to incorporate exercise. And that's our aim on this show, is to help you restore your body, get into a more healthy lifestyle, not only with food, but also with exercise. So we want to talk about how important it is to continue on an exercise regimen. And Dr. Rutland is going to join in on the conversation. You ready?
Oh, yeah.
Oh, yeah. I've seen you. I've seen your post.
Okay.
Right?
Yeah.
He's in the gym with his weights. He got no shirt on, y'all. So look on his face. He don't have a shirt on. Okay? It's true now, right? Okay, it is. Because you, as a physician, understand how important it is. Do you talk to your patients about exercise? Do you have time to talk about that? You do?
I talk to my patients about exercise.
Good.
The reason I post the gym, one thing before, I gained probably about 30, 40 pounds when I first started working here, with the free meals in the lounges that's full of fat, and walked past the mirror one time and like, what is this? And so that kind of started me getting on the road to saying, you know what?
Yeah.
I'm getting, I was early 40s and I was like, I'm getting bigger. You know what? Let me just start working out. And so that's what led me to the gym.
Great.
So, yeah, one of the things I always talk to patients about is you got to start walking.
Have to.
You got to walking for exercise.
You have to.
Yes.
It's not like maybe,
right.
But it's a must.
Right.
Yeah.
Right. And the thing about it is, and motility is big, particularly on the general surgery side. One of the first things we do when we have a patient in the hospital that you just operate on, even, one of the first things you'd say, okay, you get to sleep tonight, but tomorrow morning I want you walking, because like what I explained to patients, when you do abdominal surgery, your intestines, since the age of about 9 months, has been used to that movement around. And so when we have patients who have GI problems, they just lay up in the bed and they say, oh, my gut won't wake up to start working. It's because if the rest of the body's on vacation, the gut feels like it should be on vacation too. So we always push patients to get up and walk and be healthier. On the front end, even coming in before surgery, you can almost tell the difference in a person that's healthier and not healthier. They are sometimes the healthier person is easy to come off the ventilator to start breathing again for surgery. After surgery, to take them off the vent. People who are healthier have a quicker bounce back period. They're up, they're moving, they have better wound healing, better nutrition, and better activities. On the opposite end, what we talked about earlier, patients who have who obese or who have diabetes, they have the opposite. They have slower wound healing, more likely to get infected. I think we have some mutual patients in the past that had foot and ankle and vascular problems from just the diabetes, and this just ran rampant, and to the point where it's just closed off the vessels in the leg. And now, if you don't have any blood supply down there, there's no surgery that you can do, and then we'll start talking about amputation, and no one likes that conversation when you have to have that in the room.
Yes. Yeah. Actually, I've performed so many amputations over the past 3 months.
Really?
A whole bunch.
Yeah.
A whole bunch. And the problem I see is the gut health. And it's true. And they're like, what does that have to do with my foot? What does exercise have to do with my foot? You know, I'm here for my foot. I don't want to talk about what I'm eating and exercise. They're like, lady, you're a podiatrist, right?
Just
I'm
fix
like,
it.
Yeah.
I don't want to change my
Right,
life. Just fix it.
exactly.
Yeah, I get that. I get
They're
that
like,
all
well,
the
why
time.
is my, because let's talk about restoration. And it's tough. I get it because we have a hard time dealing with the problems, the root of problems.
That's right.
You know,
Right.
I get it. And
Right.
I'm one of those, I'm not here to judge anybody, but we should focus on exercise overall.
Right.
That prevents the amputation, your gut health. All of those things can prevent your, you know, losing your foot or limb
Right.
or other body part. Dr. Rutland, how does the gut relates to exercise? Is it creating that movement, the mobility, and
Well, what you take in, you know, what's the old saying? You are what you eat. And if you're eating a lot of junk, a lot of grease, a lot of carbs, then that gets stored in your system. And that's just gets stored in fat. A lot of times it gets stored in your vessels. So when you have not an active lifestyle, and then have a poor diet, poor exercise, then you're just asking for multiple health problems to go along with it. And then when you get these multiple health problems, you know, it's just kind of like a downward spiral. You know, it's even when patients have a gastric bypass. You know, what you see is once they have the gastric bypass, that they don't just lose the weight, but a lot of times the diabetes improves, the high blood pressure improves, the cardiac disease, all these different things improve just by changing your anatomy to make you lose the weight. The problem that we do see that's after the gastric bypass is after you get through those first couple of years where your diet is changed, is people go back to that bad diet, and then those problems come back and they say, well, the gastric bypass failed. No, the surgery was a success. The surgery just helps you lose the weight to get you healthier temporarily. And what is your job to do is to stay healthy by exercising. You know,
Yes.
and unfortunately, as we talked about earlier, is in areas that have high trauma areas, you don't have a community where you can go outside and walk around. You know, a lot of people go out, walk the dog, go walk around the block, and go to the park. If you have a park that gang-ridden or, you know, gunshot wounds fly frequently, you're not going to go there. You're not going to take your kids there. If you live in that area where you don't feel safe walking around the block because different things happen, then you're going to stay in the house. And so, you know, I used to say, you know, used to feel bad. I mean, it's not used to feel bad. I still feel bad. I used to say, you know, if you have nothing, if you can't go out to a gym or have a place like that, then you're kind of stuck and you can't exercise. But I think one thing that COVID taught many people who go to the gym all the time, that when the gyms are closed, that you have to learn to make do. I have an aunt that's 80 years old, and she couldn't go to the gym, and she had to get her 10,000 steps in. So what she did, she walked around the house all day long to get her steps in. So you got to do what you got to do to make yourself healthy. We can't use that as an excuse. My area is not safe. Then walk around your house. If you can't walk around your house, I know people make fun of the older people for the mall walkers, but that's a brilliant idea.
It's a brilliant idea.
It's the reason. Yeah, you walk around.
And it makes sense. It's safe.
Yeah, exactly.
You get a nice scenery. You got some air in there,
exactly.
and you're
exactly. And then there's
Yeah.
one thing about working out. I think a lot of people when they want to go full press right away, and you can't do that. You got to work your way up, you know. You can't go from sitting on the couch, 20 hours a day to say, I'm going to run 5 miles. It's not going to happen. And then people do that. They can't reach their goals and they get discouraged. You know, for what we tell vascular patients who have claudication, one of the things I tell them is try to walk a block. And they say, it hurts when I get halfway the block. All right, well, walk 75% of the block, walk through the pain, and then stop. Let the pain stop, and then go again. And then once you keep doing it, and you keep adding to it, next thing you know, you can run 5 miles. You can lift heavier weights. You got more cardio stamina. So,
I strongly believe that there has been much more awareness on foods and exercise and nutrition, I've seen tremendous improvement. I see a lot of people now that are really, really working out, getting their game on. They're filling the gyms, and if I'm late for a class, you could forget it, So that is so encouraging, because I believe we do want to have healthier bodies and stronger bodies and prevent diseases and live longer and a more comfortable lifestyle. And patients really can appreciate a doctor walking in the room saying, what are you eating? How are you eating? A lot of times we bypass all of that because we're busy. You want to get to the prescriptions. You got to get to what you got to get to, sometimes. But just the little things like that, just educating. Eat right, exercise, sleep well. That's amazing and truly, truly significant. And I'm one of the ones, I'm a gym person. I love the gym.
Me too.
I'm always there, and when it closed, my son said, "Mommy, what are you gonna do?"
You
I
feel
have no
guilty.
idea.
You feel guilty when you don't go during the day.
Yes.
I'm the same way. You don't go.
Oh my goodness! So I got my bike out, and I found some amazing bike trails, and it's been beautiful. So I hope if you're listening today to this podcast that you can get out, as Dr. Rutland mentioned. Even in your house, you can get 10,000 steps.
Yeah, she
really.
got 10,000
That's
steps.
amazing.
And she doesn't have a huge house. I mean, she just walked up, down.
80 years old.
80 years old.
That's amazing.
She got her 10,000 steps in during the Corona shutdown.
That's amazing.
Yeah.
Now, how is her health? Is it better? She's
she's been healthy. She's 80 years old. She's probably one of the few 80-year-olds.
Yeah.
I think she takes a cholesterol medication. That's it. But she's been healthy for years. She used to always go to the Y. But when the Corona hit, and then she's been older, she wanted to stay in the house, follow the guidelines. That she just, she's a nurse, so she knows about health. So she just kind of walked around.
Yeah. So Dr. Rutland performs so many surgeries, probably 100 a week or more. He's just about that. Do you see any correlation with how you eat and exercise with healing, with surgeries?
Yeah. So
is there a big difference?
Obese patients, diabetic patients, people with poor nutrition have more problems with wound healing. Everybody thinks it's the surgeon I have a pretty wound, I have a good surgeon. Yeah.
And then it doesn't close, and they're like, what is your problem?
Exactly.
For real, it's real.
Yeah, it opens up. Or come on, it's been 3 weeks and it's not healed yet.
They're smoking cigarettes.
And that's the thing I want to say. Are you smoking? Oh, yeah, I smoke a pack a day. And you're diabetic? I mean, so there's no oxygen going to the wound. Of course it's not going to heal.
It's so hard to... I believe when we take the time to explain it to patients, it's like, cigarette smoke can't do all of this to my body.
It does.
It
does.
So could you talk a little bit about that as well?
One of the jokes were when we were in medical school, if you don't know the answer, like what causes this, if cigarette or tobacco is in there, put that, because it causes problems all over the body. It causes pancreatic cancer, stomach cancer, lung cancer, colon cancer, breast cancer. I mean, it just potentiates so many other bad things. So tobacco use is actually bad. It's bad all the way around.
Vascular amputations, heart health, all of those things. It's so true. Thank you so much, Dr. Rutland.
Okay. Well, thank you. Happy to be here.
I'm really interested to hear what you have to say on our next episode. Thank you so much. We hope that you can take away something if you have loved ones who are diabetics, who have cholesterol, hypertension, any of those body elements. We are here to help you from a natural wellness standpoint so that you can continue to restore your body. Thank you so much. Stay tuned for the next episode.